Well, my topic is going to be on mitral valve in valve, and as you can see here, here is a patient with not only mitral regurgitation, but also paravalvular regurgitation, a very degenerated mitral valve. And as you can see here, in this patient, what we did was to, here again you can see mitral valve. Also, one can see not only degenerated mitral valve, but also paravalvular leakage. Here you can see that the valve has been placed in, and there are two rings. There is first the outer ring, which is from the previous prosthesis, and then there's an inner ring from the other prosthesis. And not only that, you can take a look at this one here. Here is the outer ring from the previous prosthesis, inner ring from the new prosthetic valve, and here is a plug to plug that mitral paravalvular mitral regurgitation, all done in the same procedure from the transseptal approach here. And not only that, recently we have also done, in mitral valve in valve patients with the LA and LA body thrombus using 2D and 3D guidance. And this has been done in about 12 patients or about 80 patients in whom the mitral valve in valve was inserted. 12 out of these patients had thrombus either in the left atrial appendage or LA body. And this paper has just been published just a few days ago in the cardiology section of the Journal of Clinical Medicine. And just to show you here that this, we can see clearly, mitral valve with a peak gradient of 14 millimeters, so very stenotic mitral valve. This is using the transesophageal echocardiography, also very high gradient across that mitral prosthetic valve. And here, if you can see that, if I can go back a little bit here and see, here we have the thrombus in the LA appendage. You can see with TH, very clearly thrombus in the LA appendage. And yet, we were able to put in a new mitral prosthetic valve here. And this is to show you the area using color Doppler, again, very severe mitral valve stenosis in this particular patient here. And go back here. I don't think movies are playing very well here, but anyhow, let me go further up here. And here one can see, showing the arrow, that catheter has actually been passed through that mitral prosthesis. And here, may show that to you very clearly here. Here is the device where has been placed through the prosthetic mitral, and the thrombus is in this area here. So one can use 2D and 3TE to make sure that you don't actually disrupt the thrombus. And this again shows another picture here where you place the device actually in the, let me see if I can show that to you easily here. This one here. Again showing the device through the mitral prosthetic valve, avoiding the thrombus. Here again, device in the left upper pulmonary vein and completely avoiding the thrombus here. And here we can see actually the three rings of the mitral prosthetic valve because this patient came back again after a few years with the severe prosthetic valve stenosis. So one could see the two rings here. And then if you go on later on, you can see there are three rings here. The outermost ring, then another ring where the valve has been put in. And when he came again after a few years, this one particular patient, you can see a third ring here, very clearly using echocardiography. And I think that's the last slide, I guess, looks like here. Some of the movies did not work here, but that's okay. And here, just to show you, you can actually measure the volumes of the thrombus using 3D echocardiography. In this particular patient, the thrombus in the LA appendage, as well as in the LA body, and the volume was actually 19.4 cc. So we can get the volume of the thrombus also. Here, I think I might be able to show you the movie here. Let me see if I can do that. Yeah, here it is, where we have the delivery device, everything placed into through the mitral prosthetic valve, avoiding the thrombus, which is right in the upper portion here, using 3D echocardiography. And again, some of the movies are not working, but anyhow, I think we can see the thrombi very clearly here. See if I can move this movie here. This one shows in a patient with a mitral valve ring, where again with coming up with the severe stenosis, and you can see the thrombus very clearly, and the device, the delivery device, actually avoiding the prosthetic valve. I think we can play the movie from there.
Technical side, can you play that video,
That's
please?
okay. I think one can. And this is after surgery. I mean, after the valve is put in, the gradients are actually quite low. The mean grade is only around 1.8 millimeters of mercury here. I think the movies are not playing, but anyhow, I think you made a good point here that even if you have a thrombus either in the left atrial body or left atrial appendage, unless the thrombus is very close to the prosthetic valve or very, very close to that, one can very carefully go in and put in the delivery device and avoid the thrombus. Now, obviously, these are patients who are very sick, who have absolutely refused surgery, so there's nothing you can do. They've given the consent. They know that they can get actually some embolic episodes and can also get stroke. And yet, so these are the patients where you really force kind of to do them, and one can carefully do this. And in these 12 patients, there was no obvious stroke or any other signs or symptoms of any embolic phenomena. So they were not there in any of these patients. Can't play the movies, but that's okay. None at all. Now, one can never exclude some microscopic thrombi in these patients, but nothing that we could see anything clinically in any of these patients. Thank you very much for your kind attention.